As my second task today, I am delighted and honored to introduce our graduation speaker. Dr. William Bergquist is an honored elder who has contributed substantially to the development of professional education, especially in the fields of clinical and organizational psychology, coaching, and consulting. He has authored 50 books and counting, still working on one, some of them considered classics. He has taught in and consulted with universities and organizations around the world and founded journals, professional associations, and the online resource banks, the Library of Professional Coaching and the Library of Professional Psychology. He was deeply involved in the emergence of graduate education in professional psychology over the last half century. He pioneered making psychology education more accessible in North America and internationally. And he founded an independent graduate school, the Professional School of Psychology, a great partner and support for Adler over the years. Our own president, R. James Little, received his Doctor of Psychology degree from PSP, as did faculty member Dr. Joyce Lai. And in fact, Dr. Kathleen Ayers, who taught in our transitional equivalency program the first couple of years of the MSI. We at Adler owe many thanks to Dr. Bergquist and his contributions. Personally, I have found Dr. Bergquist to be an extraordinary colleague and friend. And I use that word extraordinary purposefully, not just because of his many professional contributions, but because he has that rare capacity to see what is extraordinary about the ideas and the people he meets. He regularly uses that word extraordinary in describing his students and colleagues. And this isn't just hyperbole. He encourages us to put our unique gifts to good use. He has inspired me to believe in myself and to put what I know into action. I'd wager that every graduate of PSP would tell us a similar story. I'm sure that Dr. Little and Dr. Lai would agree. I am honored to introduce to you Adler Psychology's 2020 Convocation speaker, Dr. William Bergquist.
Goodness. And thank you, my extraordinary colleague, Linda Page. By the way, can you hear me okay? I bought a fancy new mic just for this presentation, so I hope it's working. So you can hear me?
Yep.
Yep. By the way, one of the key things is the higher the degree you get, the sillier are the caps that you wear. So once you get your doctorate, you have to wear these funny little hats. So apparently, once you get to the doctoral level, you can bear all forms of embarrassment. So we are there. Let me speak with you for a few minutes about where we're at. It's a great honor on my part to be invited to be the convocation speaker, especially given the close relationship I've had with Adler. And Dan, wonderful. It's good to see you again, Dan. Usually in a convocation, you talk about the wonderful world of psychology, and we must continue the traditions that we've been trained for and educated for, et cetera, et cetera. What you've already heard this morning, what we all know, is that with COVID and many other climate change, et cetera, that's occurring, the field of psychology, I believe, will never be the same again. That provides us with extraordinary challenges, but also extraordinary opportunities. So in working with my colleagues at Adler, we decided that I would talk for a few minutes about psychology in a time of COVID. And I particularly want to talk about what are the psychological impacts of COVID, and then want to talk with you about 4 tiers of care that I believe are going to be transforming the very field in which we're all part of. First of all, the psychological impact, and these are things you know, but I just want to reiterate them. First of all, what we know with COVID is that it produces diffuse and profound anxiety. Now, let me just offer a little bit of neurobiology here. As we're all aware, there's something called the amygdala. And the amygdala is something that gets triggered around essentially 3 issues. Is the thing that's approaching me, is it good or is it bad? Is it interested in my goodwill or does it want to harm me? Secondly, is this entity strong or is it weak? Is it active or is it passive? That's essentially what the amygdala is doing. It's making those assessments. Well, when we look at COVID, it is a very nasty dude. It qualifies under all 3 of these. Its intentions are clearly not positive. It's indifferent, if you will, to us and our welfare. It's very strong, and it's very powerful, and it's active. It's obviously sweeping throughout the world. So anxiety, diffuse anxiety, powerful, profound anxiety is at the heart of the COVID crisis. Second, we know that COVID has created conditions of isolation. We are alone in many times, many places, in many ways. There's a loss of social support that comes with direct contact with other people. There's a loss of meaning. Often many of us no longer can find work. Even our leisure time activities are disrupted. Perhaps most importantly, it's really disrupted family structures, the dynamics, some good things. We spend more time with our children and grandchildren, but in many ways it's disrupted the family structures. We live in isolation. Third, clearly, COVID has created societal unrest. There are unclear and inconsistent policies, particularly in my own country here in the United States. We've never confronted anything like this. The metaphor of warfare, going to war against the virus, is not working. We need to find a different way to approach this issue. The anxiety and the isolation exacerbate the existing fissures, the breaks in our societal structures. Certainly in my own country, the United States, that has helped to increase the polarization that exists. All over the world, essentially, it is hard to focus energy on something that's as elusive as COVID, which means it's much easier for us to find a local enemy in our own existing society. It's also a perfect storm that the pandemic is interwoven with climate change, the social injustice, societal, economic disparities. Finally, and perhaps most importantly, there is an extraordinary threat in many societies toward authoritarianism and centralization of control. Now, in some ways, it's a good thing. We need to coordinate. We need not only to centralize in our own countries, we need to centralize in the world. We need to find ways that we can coordinate activities all over the world. But there's also the interactional side of authoritarianism. That is, if we look at the anxiety, the isolation, the societal unrest, there's a tendency to yearn for some sort of reassuring authority. And we have the threat all over the world of really increased authoritarian control that may linger long beyond our capacity to control the virus. So what do we do about all this? Well, I want to introduce a metaphor. I want you to imagine that we're all standing at the edge of a cliff. And we look down the cliff and we see a bottom of the floor far below us. Some of us are going to fall off the cliff and fall all the way to the bottom. in which case we need treatment. Psychologists can help with the healing process through helping to reduce the anxiety associated with a fear of long-term disabilities and even death. We can also help the healing process by encouraging compliance with treatment plans. Perhaps most importantly, we can help deal with this high levels of anxiety among those who have the virus, but also among those who are closely affiliated with those who have tested positive. Our expertise as clinicians can be brought to bear on these fundamental issues. Secondly, we could build nets somewhere halfway down the cliff so that people don't fall all the way to the bottom, so that they fall, but they are helped. This is what's called as amelioration. We encourage compliance with taking prescribed medications. We provide support for alternative lifestyles to reduce the chance of future illnesses. Specific to COVID, what we know is that COVID, even for those who have recovered, has long-term impacts. It may even disrupt cognitive functioning, performance, and all. And as cognitive psychologists, as educational psychologists, we are going to be increasing the business of working with the people who have been impacted by COVID directly. Third, why in the devil are people falling off the cliff? Can't we prevent people falling off the cliff? So it's not just treatment, it's not just amelioration, it's also prevention. Encourage healthy habits, sleep, exercise, meditation, etc. We talk about stress reduction. As psychologists, we have a lot to say about all this. Specifically in terms of COVID, we have to deal with compliance with the issues of wearing masks, social distancing, limited interactions. This tends to involve us as social psychologists, as well as clinicians. How do we get people to reduce COVID? Fourth, why are we even at the edge of the cliff? What are we doing on the cliff? Can't we get people away from the cliff? Can't we focus on health rather than just the absence of illness and injury? What about public policy reform? Why not change the very character of the way in which we deal with health? And we need healthier healthcare systems. One of the things I've written about frequently is about the wounding of the healers, that our healthcare system is itself broken and it's wounding the very people who are supposed to be the healers. So as psychologists, we can help formulate plans for effective and equitable distribution of the vaccines once they're available. We can help formulate plans for more effectively addressing future pandemics so we don't handle them as badly as we have. So we have treatment, amelioration, prevention, and empowerment. TAPE, or TAPE. And some of the things I've written about is, can we use tape to bind the wounds of our societies? As psychologists, I think what's occurring and will occur even more frequently in the near future is that we no longer will just be clinical psychologists or organizational psychologists or educational psychologists. We're going to become psychologists who bring in knowledge, capacities, practices, perspectives from all regions, all areas of psychology: political psychology, social psychology, cognitive psychology, educational psychology, along with traditional clinical psychological services. And furthermore, I think what's happening with all of this is that we're beginning to come up with a much more integrated, systemic notion about health psychology. And I know in my conversations with my colleagues at the Adler Graduate School, there's a strong interest in expanding the whole notion of health psychology. And I think many of you as graduates are likely to find in the coming years that you're not just going to be clinicians, but you're going to be dealing even more broadly with the issues of health. And health for individuals, health for groups, health for entire societies. So I congratulate those of you who've graduated. I encourage those of you who are still students to recognize that the world you're entering of psychology is going to be challenging, extraordinary new opportunities. And I wish my colleagues at Adler great success in the future. I think, as Linda indicated, you're likely to have some very exciting moments coming up in your school over the next several years. And I'm looking forward to observing them, on an occasion, being part of it. So thank you very much. And once again, congratulations, folks.
Bill, I'd like to take this opportunity to say thank you for speaking with us today. As I think back over the years I know you, probably one of the strongest themes that we've had in our association is around food. We discussed, why don't you take a doctorate from PSP? And we did that over a meal in Hamilton when you and Dan were up doing a review. And I'm not even going to get into the number of meals that we've had. But one thing I can say with complete assurity, having been a friend, colleague, and student with Bill, is that he is a visionary. He is a scholar, and he's a fine friend.